Top 30 Phlebotomist Interview Questions and Answers. Welcome to Top 30 Phlebotomist Interview Questions and Answers, your complete guide to preparing confidently for phlebotomy interviews with expert responses tailored for clinical, behavioral, and technical success. 1. What is your experience with venipuncture and capillary puncture techniques? I have extensive experience performing both venipuncture and capillary punctures in various clinical settings. I am skilled at identifying appropriate veins, using both butterfly and straight needles, and applying correct techniques to ensure minimal discomfort and accurate sample collection. For capillary punctures, I ensure site selection is appropriate, especially in pediatric and elderly patients, and follow proper procedures for obtaining reliable samples. I adhere strictly to infection control standards and consistently maintain sample integrity by using proper collection techniques, handling, and labeling procedures. My consistent practice and patient-centered approach have resulted in high success and patient satisfaction rates. 2. How do you verify a patient's identity before drawing blood? To ensure patient safety, I follow a strict identification protocol. I verify the patient's full name and date of birth by asking them directly and cross-checking this information with the requisition form and ID band. For inpatients, I confirm details on the wristband. In outpatient settings, I also request a government-issued ID if necessary. If there's any discrepancy, I stop the procedure and clarify with the nurse or supervisor. Proper identification is critical to avoid errors, and I never assume a patient's identity based on familiarity. This careful verification process is key to providing safe, accurate, and reliable care. 3. What steps do you take to ensure proper specimen labeling? After collecting the specimen, I immediately label the tube at the patient's side, never leaving it unlabeled. I use the patient's full name, date of birth, medical record number, date, time of collection, and my initials. I cross-check this information with the requisition form to ensure accuracy. For barcode labels, I scan and verify before attaching them. This real-time labeling helps avoid mix-ups and ensures traceability. I also explain the labeling process to the patient to involve them in verification. Proper labeling is essential for accurate diagnostics and maintaining patient safety and trust throughout the collection process. 4. How do you handle difficult veins or patients with fragile veins? When dealing with difficult or fragile veins, I take extra care in vein assessment by palpation and using a tourniquet without over-tightening. I often opt for smaller gauge needles or butterfly sets for better control and less trauma. I may warm the site or position the arm to make veins more prominent. For fragile veins, I avoid probing and choose less invasive collection methods if needed. If I'm unsuccessful after 2 attempts, I seek assistance to avoid patient discomfort. My focus is always on maintaining patient comfort, ensuring sample quality, and practicing within safe procedural standards. 5. What tubes are used for which lab tests, e.g., EDTA, SST, heparin? Each tube type corresponds to specific tests. EDTA, lavender top, is used for hematology tests like CBC because it prevents clotting by binding calcium. SST, gold or tiger top, contains a clot activator and gel separator, used for chemistry panels and serology tests. Heparin, green top, is used for plasma chemistry tests, including some cardiac and toxicology panels. Blue top tubes contain sodium citrate for coagulation studies like PT/INR. Gray tops, with potassium oxalate and sodium fluoride, are used for glucose and lactate tests. Understanding tube function and additives is vital for ensuring accurate results and preventing test interference. 6. How do you prevent hemolysis when collecting blood samples? To prevent hemolysis, I use proper venipuncture techniques, including choosing the right needle size and angle, ensuring a steady blood flow, and avoiding drawing too quickly or forcefully. I do not shake tubes. Instead, I gently invert them as required. I also avoid using small needles unless necessary, and ensure tourniquet time is limited to under 1 minute. Proper skin antisepsis, and avoiding probing reduced trauma to red blood cells. Additionally, I ensure the site is dry before puncture. These practices help maintain sample integrity and ensure accurate laboratory test results without the need for recollection. 7. What is the correct order to draw, and why is it important? The correct order of draw prevents cross-contamination between different additives in blood collection tubes. The standard order is 1. Blood cultures, if ordered. 2. Light blue sodium citrate. 3. Red plain. 4. Gold/tiger top SST. 5. Green heparin. 6. Lavender EDTA. And 7. Gray fluoride. Using the wrong order can lead to inaccurate test results due to additive carryover. For example, EDTA can falsely lower calcium levels if it contaminates a serum tube. I followed the CLSI guidelines for the order draw strictly during both syringe and evacuated tube collections to ensure reliable and valid test results. 8. How do you handle a patient who faints during a blood draw? If a patient faints during a blood draw, I immediately stop the procedure, remove the tourniquet and needle, and secure the site. I lower the patient's head or help them lie down with legs elevated to improve circulation. I stay with them, provide reassurance, and monitor their response. Once they're stable, I report the incident to a supervisor or nurse and document appropriately. I also ensure future precautions are taken, such as having the patient lie down beforehand and watching for signs of dizziness. Safety and patient well-being are my top priorities during and after every procedure. 9. What infection control measures do you follow during phlebotomy? Infection control is crucial in phlebotomy. I adhere to standard precautions, including hand hygiene before and after each patient interaction, wearing gloves during procedures, and using single-use equipment. I disinfect the puncture site with alcohol or appropriate antiseptic and allow it to dry before needle insertion. I dispose of all sharps immediately in approved containers and avoid recapping needles. Surfaces and tourniquets are cleaned or replaced as needed. I also follow facility protocols for PP, especially when dealing with isolation patients. These measures protect both the patient and myself from potential exposure to bloodborne pathogens or other infections. 10. How do you handle an accidental needle stick? If I experience a needle stick injury, I follow established protocol immediately. I wash the affected area with soap and water without scrubbing or squeezing. I report the incident to my supervisor and seek medical evaluation promptly. An exposure report is completed, and the source patient may be tested according to facility policy. I also undergo baseline testing and follow up as required. I take such incidents very seriously and use them as learning experiences to reinforce safe practices. Following the exposure control plan helps prevent infection transmission and ensures proper documentation and care for both the patient and staff. 11. Describe a time when you dealt with an uncooperative or anxious patient. How did you handle it? I once had a patient who was visibly anxious and refused to sit for a blood draw. I calmly introduced myself and explained each step of the procedure to build trust. I allowed them to ask questions and address their fears with empathy. I offered them the option to lie down and use distraction techniques like small talk or deep breathing. Eventually, the patient agreed, and the procedure went smoothly. This experience taught me that patience, clear communication, and compassion can help even the most fearful patients feel comfortable and safe during a blood draw. 12. Have you ever made a mistake in labeling a specimen? How did you correct it? Yes, early in my career, I once forgot to label a tube immediately after collection. I recognized the error before leaving the patient's side, so I immediately informed my supervisor. Following protocol, I discarded the unlabeled specimen and recollected the sample with the patient's consent, ensuring proper identification and labeling. I documented the incident and reviewed procedures to avoid future errors. This experience reinforced the importance of labeling at the bedside and never assuming accuracy without verification. Since then, I've been extremely diligent in following specimen labeling protocols to ensure patient safety and lab result accuracy. 13. How do you prioritize tasks when handling multiple blood draws? I prioritize blood draws based on urgency, patient condition, and collection time requirements. Stat and time collections take precedence, followed by routine draws. I also consider patient appointments and fasting status. I organize my supplies in advance and double-check the requisitions to avoid delays. Communication with nursing staff helps identify critical needs or challenging patients. Efficient time management, route planning, and maintaining a calm demeanor allow me to stay on track without compromising patient care. By staying organized and focused, I ensure timely collections and accurate documentation, even during busy periods with high patient volumes. 14. What experience do you have with pediatric or geriatric patients? I have experience working with both pediatric and geriatric patients in clinical and hospital settings. With children, I use age-appropriate language, comfort techniques, and involve parents to reduce fear. I ensure quick, gentle collection using the least invasive methods, often opting for butterfly needles. With geriatric patients, I assess fragile veins carefully and take extra precautions to prevent bruising or injury. I communicate clearly and respectfully, adapting my approach to suit each individual's physical and emotional needs. My compassionate, patient-centered care helps ensure a positive experience for both age groups while maintaining sample quality and safety. 15. How do you handle a situation where a patient has no visible veins? When veins aren't immediately visible, I rely on palpation to locate deeper veins. I ask the patient to lower their arm below heart level, gently warm the area, or apply a warm compress to encourage vein dilation. I also assess the other arm and consider alternate sites such as a hand. If necessary, I consult with a supervisor or more experienced colleague for assistance. I limit myself to 2 attempts to avoid causing discomfort. In some cases, capillary collection may be appropriate. I prioritize patient safety and sample quality, always following proper guidelines and communicating clearly with the patient. 16. Describe your experience with processing and transporting specimens. I have hands-on experience processing specimens for transport, including centrifuging blood samples, separating plasma or serum, and storing specimens at appropriate temperatures. I label specimens accurately, complete required documentation, and ensure they are placed in biohazard bags with requisitions before transport. I understand the importance of time-sensitive testing and prioritize prompt delivery to the lab. I also follow chain of custody procedures when necessary. Whether using pneumatic tube systems or manual delivery, I follow protocols to maintain specimen integrity and prevent contamination or delays. My attention to detail ensures accurate results and supports efficient laboratory operations. 17. Have you worked with point-of-care testing, e.g. glucose tests? Explain. Yes, I have performed point-of-care tests such as blood glucose monitoring, hemoglobin, and rapid COVID-19 antigen tests. I follow proper protocols for calibration, quality control, and documentation before and after each test. For glucose testing, I use sterile lancets, collect capillary blood, and ensure results are accurately recorded in the patient's chart. I understand the importance of maintaining equipment, adhering to test-specific timing, and reporting abnormal results promptly. Point-of-care testing requires precision and accountability, and I ensure my results are reliable by consistently following manufacturer and facility guidelines. This experience adds to my versatility as a phlebotomist. 18. How do you maintain accuracy when working in a fast-paced environment? In high-pressure settings, I remain calm, focused, and methodical. I prioritize tasks based on urgency and patient needs, double-check requisitions and labels, and prepare supplies in advance. I avoid rushing by taking a moment to verify patient identity and collection requirements. I also communicate clearly with team members and document each step properly. Staying organized, taking short breaks when possible, and following a consistent workflow helps prevent errors. I understand that accuracy is non-negotiable in healthcare, so I never sacrifice precision for speed. My ability to stay composed ensures quality care even under time constraints. 19. What would you do if a patient refused a blood draw? If a patient refuses a blood draw, I first acknowledge their right to refuse and respond with empathy. I ask if they would like to share their concerns and listen actively. I explain the purpose of the test, how the procedure will be performed, and any potential consequences of not proceeding. If they still refuse, I document the refusal, inform the ordering provider or nurse, and follow facility policy. I never pressure the patient but provide reassurance and answer questions to help them make an informed decision. Respecting patient autonomy is essential to ethical and compassionate care. 20. Have you ever had to handle a biohazard spill? What steps did you take? Yes, I once encountered a biohazard spill in the specimen transport area. I immediately cordoned off the area, donned proper PPE, and followed the spill cleanup protocol. I used an absorbent material to contain the spill, applied disinfectant, and disposed of contaminated materials in a biohazard container. I then thoroughly washed my hands and reported the incident to my supervisor. Documentation was completed per policy. I also ensured that the area was safe for use afterward. Following protocol in these situations is vital to prevent exposure, maintain safety, and ensure regulatory compliance in a healthcare environment. 21. How do you ensure patient comfort during a blood draw? I ensure patient comfort by creating a calm, reassuring environment and explaining the procedure beforehand to ease anxiety. I use a gentle touch, apply the tourniquet for the shortest necessary time, and choose the best vein to minimize pain and bruising. I encourage patients to relax their arm and use distraction techniques like conversation or deep breathing. I check in with them throughout the process to monitor their comfort and promptly respond to any discomfort. After the draw, I apply pressure and a bandage carefully. My compassionate, patient-first approach helps make the experience as stress-free as possible. 22. What qualities make a great phlebotomist? A great phlebotomist possesses strong technical skills, attention to detail, and excellent communication. Patience, empathy, and the ability to work well under pressure are also essential. They must be dependable, organized, and focused on patient safety and comfort. Strong interpersonal skills help in dealing with a variety of patients, including those who are anxious or uncooperative. A great phlebotomist also respects confidentiality and follows protocols precisely to ensure accurate results. Being adaptable and willing to learn improves their effectiveness. Ultimately, a great phlebotomist combines compassion with precision to provide high-quality, efficient care in any clinical setting. 23. How do you handle stress during busy shifts? During busy shifts, I manage stress by staying organized and maintaining a calm, focused mindset. I prioritize tasks based on urgency, prepare all necessary supplies in advance, and communicate clearly with my team. Taking deep breaths and short mental breaks between tasks helps me reset and avoid burnout. I also rely on my training and experience to handle challenges efficiently. I remind myself that patient care and safety come first, and I avoid rushing. Supporting colleagues and fostering a positive work environment also helps reduce stress. This balanced approach allows me to perform consistently under pressure. 24. Describe a time you provided excellent customer service to a patient. A patient with needle phobia was visibly nervous before a routine blood draw. I took time to listen, explained each step, and reassured them throughout. I offered them the option to lie down and used a butterfly needle for comfort. I distracted them with casual conversation and completed the draw quickly and gently. Afterward, the patient expressed gratitude for the compassion and care I provided. They even requested me for future appointments. This experience reinforced the value of empathy, clear communication, and personalized care in creating a positive and memorable patient experience. 25. How do you stay updated on phlebotomy best practices? I stay current by attending workshops, completing continuing education courses, and reading professional journals and publications like those from CLSI and ASCP. I also participate in staff training sessions and regularly review updated protocols and guidelines provided by my employer. I follow reputable healthcare websites, join phlebotomy forums, and connect with experienced colleagues to share insights. Staying informed about new techniques, safety standards, and technology ensures that I deliver high-quality, evidence-based care. Continuous learning keeps my skills sharp and supports compliance with industry standards, helping me provide safer and more accurate phlebotomy services. 26. Why did you choose a career in phlebotomy? I chose phlebotomy because it combines my interest in healthcare with my desire to help people in a hands-on, meaningful way. I enjoy the technical precision of the role and the opportunity to make patients feel comfortable during a potentially stressful procedure. It's rewarding to contribute to accurate diagnostics and patient care while building trust through positive interactions. Phlebotomy also offers opportunities for growth and specialization within the medical field. Knowing that my work plays a crucial part in patient diagnosis and treatment motivates me to excel and continually improve in my profession. 27. How you handle conflicts with coworkers or supervisors. I handle conflict professionally by addressing issues calmly, respectfully, and directly. I focus on understanding the other person's perspective and seek to find common ground. If needed, I involve a supervisor or HR in a constructive manner. I avoid gossip or confrontation and prioritize teamwork and patient care above personal disagreements. Clear communication, empathy, and a willingness to compromise often resolve issues quickly. I believe in maintaining a positive, respectful work environment and understand that resolving conflicts diplomatically contributes to a more productive and harmonious workplace for everyone. 28. Are you comfortable working in different settings, e.g., hospitals, clinics, labs? Yes, I am comfortable and experienced working in diverse settings, including hospitals, outpatient clinics, labs, and mobile units. Each environment has unique demands, and I adapt quickly by learning protocols, understanding workflows, and collaborating effectively with team members. I enjoy the variety and the opportunity to develop versatile skills. Whether working independently in a lab or as part of a larger clinical team in a hospital, I maintain professionalism, accuracy, and patient-centered care. My flexibility and commitment make me a reliable asset in any healthcare setting where phlebotomy services are needed. 29. How do you maintain patient confidentiality? I maintain patient confidentiality by strictly following HIPAA guidelines and facility policies. I only access or share patient information with authorized personnel and never discuss patient details in public or non-secure areas. During procedures, I ensure privacy by closing curtains or doors and speaking quietly. I secure documents, label specimens appropriately, and ensure all electronic systems are logged off when not in use. Respecting patient privacy is fundamental to trust and professionalism. I take this responsibility seriously and continuously follow best practices to protect sensitive patient information at all times. 30. Where do you see yourself in your phlebotomy career in 5 years? In 5 years, I see myself as a lead phlebotomist or phlebotomy trainer, helping mentor new staff and improving departmental efficiency. I plan to continue my education in clinical laboratory science or healthcare management to expand my career options. I also aim to specialize in areas such as pediatric or trauma phlebotomy, where my skills can make a greater impact. I am committed to professional growth and continuously improving my patient care and technical expertise. My long-term goal is to take on more responsibility while remaining dedicated to quality, compassion, and safety in patient care. Thank you for watching Top 30 Phlebotomist Interview Questions and Answers. We hope these detailed responses help you succeed in your interview. Don't forget to like, share, and subscribe for more professional interview tips across healthcare careers. Best of luck on your journey to becoming a successful phlebotomist.